Welcome to our exploration of the evolution of social and community welfare in the UK. Today we'll journey through pivotal moments that have shaped the welfare state as we know it. From medieval times to modern reforms, the landscape of welfare provision has continually evolved. We'll uncover the key reports, laws, and ideologies that have driven these changes. Join us as we delve into this fascinating history. In medieval times, welfare was a community effort, primarily managed by local churches. These institutions provided care for the sick, frail, and elderly, often in what were known as hospitals. Unlike today's hospitals, these were places of communal living and support. The Elizabethan Poor Law of 1598 marked a significant shift, introducing a more organized approach to assisting the poor. Parishes became responsible for their impoverished residents, laying the groundwork for future welfare systems. The Industrial Revolution brought rapid urbanization and population growth, challenging the existing welfare structures. The Poor Law Commission of 1833 was established to address these issues, leading to the Poor Law Amendment Act of 1834. This act sought to reduce the burden on parishes by centralizing welfare provision. It marked a move towards a more systematic approach to welfare, though it was met with widespread dissatisfaction.
The 20th century saw the development of various theories influencing welfare policy. These included means tests, healthcare, and national insurance, designed to reduce reliance on the unpopular poor laws. In industrialized societies, the welfare state emerged as a means to alleviate poverty and social exclusion. This period laid the foundation for a state-centered approach to welfare, providing essential services like income support, housing, and healthcare.
The welfare state aimed to manage life's risks, such as unemployment, old age, and illness. Political views on welfare varied, with right-wing individualists opposing state intervention, while left-wing collectivists supported it. Despite these differences, the welfare state grew, shaped by the need to provide for basic human needs. This era saw the establishment of systems to ensure income, housing, education, and healthcare for all citizens. Marxists view welfare as a result of working-class resistance to exploitation. They argue that welfare systems reflect societal contradictions and serve the interests of the capitalist class. This perspective emphasizes the power dynamics inherent in welfare provision. It challenges the notion of welfare as purely benevolent, highlighting the influence of economic structures on social services. Conservatives prioritize social order, tradition, and religion, viewing welfare as secondary. They emphasize the importance of structured social relationships and inequalities. Welfare, in their view, should not disrupt these societal structures. This perspective often leads to a focus on individual responsibility and limited state intervention in welfare provision.
Liberal individualism centers on personal freedom and mistrust of state intervention. Liberals believe in self-regulating societies with minimal state interference. They prioritize certain freedoms, such as speech and worship, over collective welfare measures. This view supports a welfare state that ensures individual rights while promoting personal responsibility.
Before World War I, the Liberal government introduced policies to combat poverty, such as health, housing, and education reforms. These measures aimed to establish a national minimum standard of living. The goal was to prevent destitution and improve living conditions for all citizens. This period marked a shift towards more comprehensive welfare policies, setting the stage for future developments.
The 1911 National Health Insurance Act was a landmark in welfare provision. It provided health insurance to workers, aiming to improve productivity by reducing sickness absence. The act was part of a broader movement to address the needs of the working class. It laid the groundwork for future healthcare reforms and the eventual establishment of the NHS.
The Beveridge Report of 1942 was pivotal in establishing the modern welfare state. It proposed comprehensive social insurance and benefits to tackle poverty and social issues. The report laid the foundation for key reforms. including the NHS and Social Security. Its vision of a welfare state aimed to provide support from cradle to grave, transforming British society. The National Health Service, established in 1948, revolutionized healthcare in the UK. It provided free and universal healthcare funded by taxation. Initially met with resistance from doctors, the NHS quickly gained popularity. It represented a significant shift towards state-funded healthcare, setting a precedent for other countries. The NHS remains a cornerstone of British welfare provision.
Financing the NHS has been a persistent challenge since its inception. Initially underestimated, the demand for NHS services quickly exceeded expectations. The government introduced charges for prescriptions and dental care to manage costs. Despite financial struggles, the NHS remains a vital part of the welfare state, continually adapting to meet the needs of the population.
Community care emerged in the mid-20th century, driven by political and social changes. The 1959 Mental Health Act encouraged care outside institutions, integrating patients into the community. This shift was supported by advancements in mental health treatments and a growing patient rights movement. Community care aimed to provide more humane and effective support for the mentally ill.
The 1984 Griffiths Report was a catalyst for modern community care policies. It led to the Community Care Act of 1990, which redefined how services were delivered. The report called for better coordination and funding of mental health services. It highlighted the need for comprehensive care plans tailored to individual needs. This era marked a significant step forward in community-based welfare provision.
The late 20th century saw efforts to modernize mental health services. Strategies included increasing mental health beds, supported housing, and training for health workers. The government aimed to improve service quality and accessibility. New frameworks emphasized collaboration between health providers and community organizations. These changes reflected a commitment to enhancing mental health care for all. The New Horizons initiative marked a new era in mental health care. It focused on promoting mental well-being alongside physical health. The program involved multiple sectors, including government, communities, and the voluntary sector. It aimed to reduce the stigma of mental illness and improve access to care. This holistic approach sought to integrate mental health into broader health and social policies.
The UK's welfare system has seen numerous milestones, from the Elizabethan Poor Law to the Care Act of 2014. Each milestone marked a significant shift in how welfare services were delivered and accessed. These developments reflect the evolving needs of society and the ongoing commitment to social justice. They highlight the importance of adapting welfare policies to meet contemporary challenges.
Comparing past and present healthcare reveals significant advancements in access, quality, and technology. The NHS provides universal healthcare, a stark contrast to the limited services of the past. Modern healthcare emphasizes prevention, collaboration, and patient choice. Despite challenges, the NHS continues to evolve, ensuring high-quality care for all UK residents.
Prescription and dental charges have fluctuated over the years due to financial pressures. Initially introduced in the 1950s, these charges were abolished and reintroduced multiple times. They reflect the ongoing struggle to balance healthcare funding with accessibility. Despite these challenges, the NHS remains committed to providing affordable care. The system continually adapts to meet the financial demands of healthcare provision.
The NHS is renowned for its comprehensive and equitable healthcare services. It has succeeded in providing universal access, preventive care, and high-quality treatment. However, it faces ongoing challenges, such as rising costs and health inequalities. The NHS's adaptability and commitment to public health make it a model for other countries. It continues to evolve, striving to meet the diverse needs of the UK population. The future of welfare provision in the UK involves addressing current challenges and anticipating new ones. Rising healthcare costs and growing demand require innovative solutions. The focus remains on ensuring equitable access and improving service quality. Embracing technological advancements and collaborative approaches will be key. The welfare state must adapt to changing societal needs while maintaining its core principles.
As we've seen, the development of social and community welfare in the UK is a complex and ongoing journey. From medieval times to modern policies, each era has contributed to shaping the welfare state. The balance between state intervention and individual responsibility remains a central theme. The welfare system continues to evolve, striving to meet the needs of a diverse and dynamic society. Thank you for joining us on this exploration of welfare history. Thank you for watching our exploration of the UK's social and community welfare evolution. We hope this journey through history has provided valuable insights into the development of the welfare state. Stay tuned for more engaging content on social policies and their impact on our lives.